Research has shown that men access health services less than women, but yet still have longer hospital stays and costly care. Men's life expectancy is also lower than women's, and men also have higher rates of cardiovascular disease, diabetes, and cancer. Dr. Dennis Bassier, who is the coordinator for the Ministry of Health's Men's Health Unit, has been working to change this for the past several years with regular medical outreaches across the country. According to Dr. Bassier, they access more patients during outreaches.
We don't offer anything other than what's already in the healthcare system at health centers, regional hospitals. So we just try to more or less take the message out to men that these services are available and where they can access them.
Dr. Bassier said he has found that men oftentimes simply do not know where they can access health services. And so he has also begun a series of outreaches to reach and educate men to take their health more seriously.
Education, sensitization, basically trying to get out to areas where the access to healthcare is still lacking. So even though we have health centers, health posts in a lot of areas, there's still a lot more that are actually requiring those services. So even though we do outreaches to health posts and they're in some remote areas, we still go further to actually carry the message into those persons who sometimes don't see civilization for weeks and even months on end.
Access to health care in certain parts of the country is another factor that exacerbates men's poor health-seeking practices.
For example, we do a lot of work in the hinterland region, the whole, the left side of the country, region 1, 7, 8, 9, and even we do some work in region 10. So getting into some of the mining areas, places like Guns, Ishalton, even as far as Madia, Paramakatoi, all those areas. So even though there are health centers and health posts in those areas, sometimes they just need a little extra push.
In some cases, Dr. Bassier explained that men don't know how to take care of their health and are not familiar with what services are available.
Persons like to know that the Ministry of Health is actually taking an interest in their health care, so they're sometimes more open to actually coming out when they hear that a visiting team is there for them.
One of the major focus areas for the unit is men and their prostate. Prostate cancer is the leading cause of cancer among Guyanese men.
Well, more specifically, we're trying to focus on prostate cancer and the screening for it. So getting their prostate checked, if that be the case, and simply just counseling, right? Living a healthy life, eating right, drinking the right amounts of water, things like that. It goes a long way in just trying to get them on the right path, health-wise anyway. Normally, we would advise persons, at least when they touch 40, they should at least get the checkup to see what's their position on that, because as men get older, their prostate starts to swell, starts to enlarge. But if it is that they have any family history, predisposing factors, family history, a father, a grandfather, or even a brother that has prostate cancer. I know recent studies have actually shown that even if you have a mother or a sister with breast cancer, that cancer gene can actually be transferred to the male, and he would be the first person or first male in his family to suffer from prostate cancer.
Dr. Bassier now shares how he maintains his health.
I try to live a balanced life. And we're not saying that you're supposed to cut out all salt or cut out all sugar, because we can't live without sugar, right? And then salt is actually needed to maintain a certain level of blood pressure. So you just find that in moderation and just try to live in balance. I do that. I use sweet, I use salt, but I make sure that I exercise enough to actually moderate it, balance off everything. So, and stay hydrated. A lot of persons are not drinking water as they should. And especially with this wonderful climate change that we're going through, heat is very pivotal in all our daily lives. So we need to be drinking a lot of water to stay hydrated. Honestly, we just need to get the sensitization to a point where our health literacy is, above average. Because generally persons know what they should do, what they should be eating, what they should not be eating, but they're just not applying it. Simple as that.